Turning now to a health alert in Ann Arbor Public Schools. They are pushing to prevent the spread of the measles. Well, tonight, the number of cases continues to grow around the country, with 5 confirmed right here in Michigan. 7 News Detroit reporter Darren Cunningham is speaking with a parent and the Washtenaw County Health Department and explains the new policy now in effect for students.
There are no known cases of measles here in Washtenaw County, according to the health department, which also makes it clear that the guidelines put out by Ann Arbor Public Schools are simply coming from the state.
When we have cases introduced and someone is unvaccinated, they're incredibly likely to get ill. So about a 90% chance of getting ill if you're exposed.
A risk you don't want to take, according to Susan Ringler-Cerniglia with Washtenaw County Health Department.
What we did here in Washtenaw County, because we have measles cases, obviously in other parts of the US and in other parts of the world, there's been several now in Michigan. I think we're up to 7. We sent out information to all of our local school districts, reminding them of what this disease is like, what it looks like, and what would happen if we have a case.
Ann Arbor Public Schools then published a letter letting parents know if their child is unvaccinated, state law must be followed if anyone in the district is exposed.
Public health code in Michigan allows for exclusion of those students that aren't vaccinated. So in this case, that would mean that if there's an exposure, what we call the incubation period for measles is about 21 days.
That means students and staff who are unvaccinated can be told to stay away from school for 21 days.
I think this is a pretty good safety net in place.
Najla August, whose son attends Ann Arbor schools, didn't want to say whether her 4th grader is vaccinated, but she says she agrees with the guidelines in order to ultimately protect the immunocompromised. At the same time, she feels no one should feel forced to get vaccinated.
I like having the choice where people can make their own decisions. Maybe some people have some religious concerns. Some people might have different concerns. Whatever their concerns may be, I just don't like this authoritarian telling everyone what to do with their bodies.
The Centers for Disease Control reports getting the MMR vaccine is much safer than catching measles. And Cerniglia says 1 dose is 93% effective, 2 doses 97%. In Ann Arbor, Darren Cunningham, 7 News Detroit.